A lot of questions have come up. I get asked a lot of questions. Is the vaccine going to be safe? And my answer to that question is yes, it appears to be extremely safe with the data that we have right now. The other thing that's really important is that this vaccine got made so quickly because of all the work done on other vaccines, in particular on HIV over the past 15 to 20 years, such that the field took all of that technology and frame shifted it immediately last January to working on the COVID-19 vaccine. So where this vaccine was accelerated was not in the safety measures and in the development, but in the production, and that the production started way before it normally would have. It started at the time of the clinical trials when there was a vaccine that was being tested. And so it was done at what's called at risk. And so if the vaccine had not worked, then all of this material that had been made would have been destroyed. But because it did work, it can now immediately be deployed the way this vaccine, and hopefully next week the Moderna vaccine, and hopefully first of next year several other vaccines will be rolled out, so that the entirety of the American population in short order can be vaccinated. We don't know if these vaccines protect against asymptomatic infection. All we know is that they do a really good job of protecting against disease, and that's a big, big deal. But we don't know if they prevent asymptomatic infection. Why is that important? Well, this is an unusual virus in that this virus can cause a situation where even though the person is not symptomatic, the virus is being produced and can be spread. And so until that time, we have to wear masks and keep our social distancing. And those studies are ongoing and should be out sometime in June. So we'll know that answer. And then we can take off our mask and feel comfortable that we've been protected. We don't know how long this vaccine's protective immunity is going to last. And that's going to dictate how often we need to get boosted. If it wanes within a year, we'll have to get a yearly booster. If it lasts 2 years, then that will dictate when we need to get boosted. If it's like the tetanus shot and it lasts 10 years, then there'll be an every 10-year booster or something like that. So this will all be known. We're going to be learning an enormous amount about this virus and this vaccine throughout the coming years, but these questions we should know by the end of this coming year. Yes, the vaccines will all be very carefully evaluated, and how they work, how much they protect, how well they protect, what the safety profile is, will all be made public and transparent. And so those decisions can be made based upon the data that come out. And the data will be available to not only to doctors and their patients, but also to all of the American public. Yeah, so Duke has had several major roles in fighting the pandemic. The first is that we worked hard on and are working hard on the next generation of vaccines, both for when this virus, should this virus escape the current immune responses, we'll have a vaccine there that will take care of those escape viruses, because this is a kind of virus that does mutate and escape. Fortunately, it's not doing that very quickly, but should it happen, we'll have vaccines ready for that. We don't know how potent this vaccine is going to be, and so we're working on much more potent vaccines that last a long time, because we don't want people to have to be vaccinated any more frequently than they need to be. And we don't know how long these vaccines are going to last.